The patient safety campaign, 1,000 Lives, is particularly important because it ensures there's consistency of practice across the organisation, and there are standards that individuals sign up to ensure that we are minimising the risks to reduce adverse incidents in terms of patient care. The Trust has responded to the campaign very positively. It's sort of embraced all of the philosophy and the principles around the 1,000 Lives, and the spread is important because it's not just about from the Trust board down, it's particularly ensuring that it's embedded within clinical practice, and it's the grassroots staff that need to embrace this. So my answer to that is that it's from the Trust board right down to the staff at the grassroots. My contribution to the campaign is that I'm joint executive lead with Bruce Ferguson, the medical director. I am professionally accountable for nursing across the ABM Trust. We have approximately 8,000 nurses within the Trust, and my contribution is ensuring that the 1,000 Lives campaign is embedded in the fundamentals of care, and for example, standards around pressure sore prevention, and also the infection control elements of the campaign. The frontline nurses have embraced the campaign because it's all about basic nursing care. It's about ensuring that the fundamentals of care are part and parcel of everything we do in day-to-day practice. So the important message there is it's not an add-on, it's integral to the care that we deliver to our patients. Some of the successes have very much been around, if I could just give for an example, the pressure sore prevalence and the standards around that. We've had some PDSA cycles on a number of our wards, Plan, Do, Study, Act, and the outcome of that is that we have a zero tolerance to the development of pressure sores. The particular challenges for spreading 1,000 Lives across the organisation is the fact that the organisation is so large. We have 16,000 staff. But if we can embed it, as I've said before, so it's not an add-on to everything we do, I think we will succeed in the challenge. It's not going to be easy, but it refers back to what I said earlier about standardised practice. It's second nature. Well, one key priority for myself as nurse director within the organisation is developing our nursing strategy. The nursing strategy will be the driver for standards of nursing care across the organisation, and the key component of the nursing strategy will be the 1,000 Lives campaign and the action plan that we will be measured against, and ensuring that those specific actions are also embedded in the performance review and the performance of the directorates across the organisations. The legacy for the campaign would be that we have reduced significant harm to patients, but we can measure and evidence that this campaign has actually made a difference. One example that I can give is in terms of the care bundles that we have introduced within the intensive care unit. We have patients who are intubated within intensive care, and the 1,000 Lives campaigns have clear standards in terms of how you care for those patients, which in turn reduces pneumonia, for example.